very good afternoon to all,
Good
and I
afternoon,
hope
Dr.
my slides are visible over there.
Yes, sir.
So I just tweaked the topic a little, and I thought I would speak on cancer and precision medicine, though it's almost aligned to the previous topic. So this is what how it is translating into our current practice, how genetics is translating into our current practice. Just wanted to give an insight on that. Of course, I would be touching upon the basics of it as well. So the basics of it is when we talk about gene, and when we look at the place where all this come from is the chromosome, and we see that in the chromosome of each cell, and we know that this particular chromosome has DNA as the basic material. So this DNA is basically having these particular genes which are there, and these are in the form of multiple pairs of nucleotides which are there. The genetic material in another term is the software of the cell. So however the software would be while the cell is growing, proliferating, it can actually direct how the cell would eventually behave. So if there is an aberration coming, and that's what we call that, if there is a virus coming in the software, there could be shutting down of the system. Likewise, if there is a mutation coming up, and if this mutation happens to actually cause the cell go haywire, this could actually lead into cancerous formation, and that's what happens. The normal cell division, as we can see, is pretty much regulated. So the normal cell division is happening. The cells would proliferate and it would eventually die as well. So they would undergo apoptosis. That's called the cell death. However, unlike the normal cell, there is no regulation. These cancer cells, which are a part of our body, which are the part of the normal cells rather, and they have gone anarchic, and then they start actually dividing in a very haphazard manner, and produce multiple clones or multiple cells like them. So this is what is going to give rise to cancer. And why does it happen is because of a lot of factors, and heredity is one of them. And fortunately, most of the cancer's heredity component is usually 5 to 10%. But there are other more common factors, and that's environmental factors, exposure to chemicals, UV radiation, viruses, smoke, tobacco smoke, and this all can actually affect the DNA of the cell and can actually cause the cell to go anarchic. When we talk about this, actually we see on the two extremes the age group. And this is the child where the body is growing, the cells are multiplying in a lot in number, and a senior citizen where we see that the cell would actually have to age, and the cells would actually have apoptosis, that is cell death would happen. Now, in either of the extremes of the age, if the control, the fine balance goes haywire, that is, in a child, if there is excessive production of cells, this could lead to cancer, or eventually in the other extreme, if there is, because of multiple toxin exposure, that the DNA goes aberrant, then we see that such a cell would again turn into cancerous cell. This can happen in elderly age group. So most of the times the cancer happens in the extremes of the age, though we do get to see middle-aged individuals having malignancy, but most common prevalence is in the extremes of the age. When we see that what is eventually a tumor, it's just a accumulation of these cancer cells, as we can see over here in the cartoon on the right, that these cells, aberrant cells, keep on accumulating and form a mass, and this is what is called as a tumor. Now, again, how does this all happen? We see that the normal cell would have the death cues, it would have growth inhibition cues, it would have on these two formats a cell death happening or no cell division happening. Then there would be the survival cues as well as proliferation cues. So on the basis of which the cell would survive or proliferate accordingly. But what happens in a cancer cell, as I told, that these cues are actually, these signals are actually, they form a loop and then they keep on inciting upon the cell, and which leads to uncontrolled survival and proliferation of this particular cell. Now, oncogene is basically a part of the normal gene, and this oncogene is supposed to actually lead to normal proliferation of the cell, but sometimes these genes, they get amplified, and therefore they've been called oncogene because they were identified in certain subset of cancers. These genes were the drivers of cell growth, and therefore these are called oncogene. So these are basically normal genes which have gone mutated, and or they have got rather amplified, and they start, regulating the cell division very rapidly. Then what are basically anti-tumor suppressors genes? So these are genes which are supposed to be the watchmen or the guards for such anarchic cells. And if they take a hit, actually, because our body is good in actually correcting things, but if these guards take a hit, they actually result in the normal cells again going haywire, and the anarchic cells are not controlled, and the replication keeps on happening. So this is how a normal cell would turn into anarchic cells and not inhibited by these tumor suppressor genes, which would be absent in certain individuals. Then it could lead to a rapid growth. And this what actually results, it's accumulation of cells, which is called a tumor, as you can see over here. And then what you can see is for the cancer cell, the body tries to actually inhibit these cancer cells by actually inciting an immune response. So there are all these white blood cells, the T cells, the macrophage, the NK killer cells, they all try to actually kill the cancer cells, inhibit the cancer cells, cause apoptosis. But sometimes these cancer cells learn to evade, and they learn to evade, and that's how they learn to survive. So there is always immune cells next to the cancer cells. They're trying to overcome, but then eventually they also get exhausted, and the cancer cells learn how to evade these particular cells. So this could actually result in, evasion could result in spreading eventually through the bloodstream. So the cancer cells can then spread through the bloodstream and go to other organs. So for example, as you can see in the cartoon over here, that the bowel, that is the large bowel over here, if the cancer cell arises, then it can actually, if unchecked, go to the liver and also go to the lung. So this happens through the spread through the bloodstream. Also, it can happen spread through the lymphatics. So the green channel over here, what you see is the lymph node. This is the parallel sort of pathway along the bloodstream, the lymph node where the plasma or the lymph actually travels. That's the white part of the blood. So talking about what has happened, traditional medicine versus precision medicine, we have got to know, we have now known how the chromosome is, how many genes are there, we know the details of it. So now we can actually harness the power of it, and what we are now using is genetics, immunotherapy, and targeted therapy. Just to give you a glimpse of it, well, how it is done, personalized cancer therapy. Well, earlier it was a bunch of, a number of people all together where one used to actually give some therapy. Now, we are now able to identify, okay, who are the particular individuals with one particular mutation, let's say the yellow mutation. And the yellow mutation, they are all grouped upon, and they get one particular yellow capsule, let's say. Let's say that the yellow mutation is the target gene to be hit. So there is a capsule for these particular mutations once they are all grouped. And this is what is called personalized cancer therapy. This therapy is meant for this particular individual. This therapy is meant for this particular cancer. So this is how one can actually look into better treatment plan. This all started when this publication came in Time magazine, and we know that in year 2001, targeted therapy started trickling in because of the information on the cancer genome. The human genome got completed, and therefore we could identify certain genes where this was one particular medicine, Gleevec, that is imatinib, which was used for chronic myeloid leukemia, and still till now, till date, actually this has caused a magnificent control of the disease over the past 2-3 decades, and the disease now is actually very controllable and is almost reaching near cure rates. So how to detect these mutations? There are ways to detect these mutations. All starts with getting the tissue sample from the cancer cell, from the tumor. So as you can see in this particular video, in this particular cartoon over here, that the needle is passed through this particular tumor lump in the lung, and this is what is the tissue which is taken. So biopsy is a very important starting point of all investigations. If the biopsy is not feasible, then one can actually consider blood sample, and this is what we call as a liquid biopsy. A liquid biopsy means a blood sample where these cancer cells, the DNA of these cancer cells, as you can see the green spiral, these circulating free DNA are the DNA of the cancer cells. The cancer cell death take place and the DNA is released in the bloodstream. This sample is taken and is sent for analysis, and one can then find the genomic print of the cancer cells. So one particular technology, what we see is NGS, and this platform has helped us in actually laying down the details of every genes, and it helps us eventually, after giving a lot of data, helps us in eventually identifying the available therapies. So how all these targeted medicines act, and what we can see is an example of EGFR mutation which happens in lung cancer cells. And what we see is when these two oval shaped structures, they bind to each other, they cause across the cell membrane, these two receptors, they come along and a cell cycle starts, and these cells then start proliferating very rapidly. But if in case you can block these this particular binding over here, and that is what is happening, that these particular tablets stop the binding of these particular antigens or these particular proteins over here, then the cell cycle actually stops, the proliferation does not take place. What you can see over here is just an example. Huge mass in the lung. As you can see, this all gray area was a huge mass in the lung, and this patient was nearly on ventilator. After just taking a pill nearly for 7 days, a lot of resolution happened, a lot of clearing of lung took place. So this targeted therapy can act very nicely and can control the disease pattern very nicely. This is also called the Lazarus Effect. That is, the patients who are absolutely bedridden can actually rise, get better. So this is what is called Lazarus Effect. You need to identify such genes if they are there in these patients. Just some background of evidence. What is the scientific evidence over here? I just wanted to show you this particular medicine in the purple box over here, Tarseva, 150 milligram. This is given, compared to chemotherapy. And this is used in stage 4 lung cancer. And you can see that this particular oral pill has actually brought down the death rates nearly 66% as compared to chemotherapy. So it is working much better than chemotherapy is. So it not only improves the quality of life because it's a tablet, so taking a tablet versus chemotherapy is always easier, but it is also improving the survival over here. It is improving the overall outcome, the longevity. So that is what is very important. Another example, a very glaring example of a genetic mutation, if BRCA mutation is present over here in high-grade ovarian cancer, again you see that giving this particular drug, which is called the PARP inhibitor, can actually lift the particular curve, the survival curve, and improve the longevity of the patients starkly as compared to not giving this targeted therapy. This is just a figure, which is a cartoon, which is showing a lot of evolution which has taken place in terms of targeted therapies in various cancers. It's just a snapshot of some medicines. There are a lot more medicines than this, and a lot more in pipeline are coming.